Hi there. I'm so excited to welcome you to the Arthritis Life podcast, where we share arthritis life stories and tips for thriving with autoimmune arthritis. My name is Cheryl Crow, and I am passionate about helping people navigate real life with arthritis beyond joint pain. I've been living with rheumatoid arthritis for 20 years, and I'm also a mom, occupational therapist, video creator, support group leader, and I created the Room to Thrive self-management program. I am so excited to help you live a more empowered life with arthritis. We're going to cover everything from kitchen life hacks to navigating the healthcare system to coping with friends who just don't get it. Seriously, no topic is going to be off limits on this podcast. My interviewees and I share our honest stories of how chronic illness affects our lives. This includes discussions about mental health, sex, shame, pregnancy, body image, advocacy, self-acceptance, and so much more. You'll hear stories from all ends of the spectrum, from a person who's living in medicated remission from psoriatic arthritis to somebody living with severe mobility restrictions and severe pain from rheumatoid arthritis. You'll hear how people manage their conditions in different ways, like medications, mindfulness, movement, social support, work accommodations, and so much more. You'll also hear from rheumatology experts who just get it. We'll dive deep into the science behind chronic pain and what's the latest evidence for lifestyle changes that can help you thrive with arthritis, including exercise, sleep, nutrition, stress reduction, and more. This is your chance to sit down and chat with a friend who's been there. Ready to figure out how to manage your arthritis life? Let's get started. I'm so excited today to have a fellow occupational therapist to talk about ways to connect to your body, even with chronic illness, in ways that are like more compassionate and kind to yourself. So I'm happy to have Lindsay Voorhees here. Welcome.
Thank you.
Yay. We're so happy to have you. And if you could just start by letting the audience know, like, where do you live and what is your relationship to either arthritis or chronic illness in general?
Yeah. So I live in Durham, North Carolina. I grew up in Southern California, but moved across the country here. And my relationship to arthritis and chronic illness is primarily through being an OT. I do at this point in my life also have friends and family members who identify as living with chronic illness. But primarily my first connection point was through my professional experience.
Yeah, and I always like when I interview subject matter experts, I always like to know, why did you enter the field that you did? So why did you become an occupational therapist?
Yeah. Well, I'll start by saying it was a winding journey. I didn't like in high school know that this is what I wanted to do. My mom was a nurse, and so I kind of heard like PTOT referrals broadly, but that didn't really mean anything to me. So I actually like through college thought that I would be working with kiddos. So I was kind of in the child development world and psychology, and started going down the social work path. And this might sound familiar to some people, like didn't know what I wanted to be when I grew up when I was 21 or 22 years old. So I had
Same.
actually, yeah, maybe still don't know. I had kind of gone down the path of social work and counseling. I had actually started a mental health counseling program that was specific to dance and movement therapy. So expressive therapies broadly. People are maybe more familiar with like art therapists and music therapists, but there are also dance and movement therapists who primarily use expressive arts as the therapeutic approach. Something I'm still really interested in, but when I was in that program, I had a placement that like really just opened my eyes to a lot of other things I could be doing that I wasn't aware of, like special education and occupational therapy and speech and language pathology, and so I kind of had my quarter life crisis, and just like put pause on that program, learned so much, and it really was the foundation, and continues to be the foundation for like the work that I do. But I realized I wanted maybe a broader tool belt, I guess, is the way I can describe it in our country, especially. The opportunities for getting to be a practitioner in mental health are unfortunately like pretty niche. Like we need a lot more, of course. And when I was thinking about like, I also want to work with kiddos and adults who have physical disabilities and like wanted just a broader approach to how to support folks. And so when I came across OT in a few different ways and had some shadowing experiences, it just felt like a really good intersection of how do we think about health and well-being in a more holistic way, like mental and physical health, which have gotten, separated into this false dichotomy. So then I applied to school and I guess the rest is history. It's been a winding path through different jobs, but I have been in the OT world for the past 9 years.
I love it. I really resonate with so much of what you're saying. I also was really interested in either becoming like a mental health counselor, or in my case, I loved working with kids and thought about becoming a teacher or a special ed teacher. And so I think occupational therapy is it's a specific degree that allows you to do a very broad variety of things, And I always say that if I could rename it, I would name us like life skills therapists, because it comes down to like helping people function better in the context of their lives, whatever is going on physically, mentally, social, environmentally, And so I actually have like I'm restraining myself from asking you a million follow-up questions about like dance and movement therapy because that sounds so amazing. But for the topic of this episode, I'm gonna move on to ask how did you come to specialize in helping people with chronic illness specifically? Because unfortunately, people who've listened to the podcast before know that I have one of my soapboxes is that not enough, first of all, not enough people just help people with chronic illnesses in general. Like our healthcare system is set up on like an acute care model where like you have an injury that's going to rehabilitate in a few months or weeks versus like a chronic illness. So even within occupational therapy, I feel like there's even so many gaps for chronic illness. So how did you come to specialize in this area? If you have ever felt completely lost or utterly alone while trying to navigate real life with rheumatic disease, listen up. I am here for you. I created an educational program to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. And it's called Room to Thrive. After earning a master's in occupational therapy and completing hundreds of hours of additional training, I created a step-by-step guide to help you truly thrive with rheumatic disease. This is the only program I know of that's designed to improve quality of life for people living with inflammatory, autoimmune forms of arthritis, like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, Sjogren's disease, and more. During the self-paced lessons, you'll learn how to manage pain and fatigue, cope with stress, navigate relationships, and continue doing the things that matter to you and bring you joy. The goal is really to help you improve your quality of life and learn how to thrive with your rheumatic disease right now, rather than waiting for a distant day when it might be cured or healed. I really created the down-to-earth, practical, heartfelt resource I wish I had had when I was first diagnosed at age 20. If you want even more in-depth support, you can join the 12-week Room to Thrive virtual support group, where you'll be surrounded by people who actually get what you're going through, people who will provide the encouragement, validation, and support that you deserve. Each group is expertly moderated, so you don't have to worry about the kind of misinformation that spreads like wildfire in the free-for-all social media groups. If you're on the fence, don't just take my word for it. Here's what Katie had to say in March 2023. I was lost and overwhelmed with my RA diagnosis. It felt overwhelming to know what to read, what to do, how to spend my energy trying to research on the internet. Room to Thrive did that for me. It's been like getting a crash course in my diagnosis along with a community who gets it. To see all the details, including the dates for the next support groups, go to the link in the show notes or bit.ly/thriveroom with a capital T and capital R. You can also just email me anytime at info@myarthritislife.net. And don't delay if you're interested, because each group is capped at 16 people or less in order to make a small, intimate group atmosphere. Thanks so much for your time, and I can't wait to get started with the next groups. And I can't wait for those of you who are interested in the self-paced option to go ahead and join that at any time. Bye-bye for now.
Yeah, so kind of two different points that come to mind. So during grad school, I actually had the opportunity to lead a Dance for Parkinson's program in the community. And that was such a gift to be handed that program that a friend of mine started. And so while that was not OT practice, it did really shape as I was moving through my graduate program, like thinking about, like what is meaningful? What does a good life, what does a good day like mean and look like? And having like conversations, not necessarily asking those direct questions, but like participants would share, they'd be there on a day when their mobility looked really different than the week before. And they might choose to sit for the whole class rather than kind of transition to standing. And also that was like, it opened up these other questions that I do think we don't get the opportunity to really spend time in within the medical model, which is like when there's not a cure. So there are many conditions in which, a cure in terms of like not just total remission, but like doesn't exist anymore. Like there are so many conditions we could name, right? I'm just using the example of Parkinson's, like what does it mean to still be able to move towards your goals, to still be able to like align with your values, to do all the things that you need and want to be able to do, and to adapt in the face of changing, whether it's progressive or fluctuating, flaring kind of conditions. So that was, and the last part I'll say about that experience with Dance for Parkinson's, it really reminded me how important, and we don't have good ways to measure this, no matter how many like quality of life indexes we look at, like just how meaningful it is to like just have fun and like find the things that bring you joy, right? Like not in terms of, we can talk about this later, but the utilitarian like self-care in order to reduce symptoms, that matters. And also just like being a human and like having access to like things that are fun and joyful, not as a means to an end, but just like inherently. So that was there even before I was practicing and really getting to do work around kind of working with folks with chronic health issues. My OT journey started in an inpatient rehab context. And so I was on a spinal cord injury unit. I learned so much. And I will argue that I don't think we use the language of chronic illness around that, but in terms of living with chronic disability, I think there's a Venn diagram in terms of like some of the folks I worked with had an acute injury, and some of the folks who came onto our floor were aging with an injury that they had 20, 30, 40 years ago. And then, what does that look like in terms of the aging process, and also, secondary conditions that come up along the way. So I thought of that in a very acute way, but now looking back, I'm like, even there we were having conversations about not just what does this look like when you leave the hospital, but like years from now, especially if it was a more complete injury, you're learning a totally different way of being and figuring out how to do that. But I'd say the most explicit way where I really got to start diving into working with folks with chronic health issues was in my outpatient experience. I worked in primarily a neuro or neurologic outpatient clinic, and we would have referrals kind of across the board, but I would say primarily had referrals around chronic or progressive neurologic conditions, autoimmune conditions broadly, post-cancer recovery. That was when I wish we got a little more. We'd often get referrals around like immediately after surgery when there's kind of more obvious things going on. But I also lump that into when I think of chronic illness, like I have several people I love who have been through a breast cancer journey and who live with maybe more subtle or invisible kind of changes in their bodies because of that. So that was that was where I first was introduced to, I had to reckon with the expectations from providers, from an insurance-based system that, as you alluded to, Cheryl, like really wants you to fit this model of like, you broke a bone, in 6 weeks, you'll be at this place, pretty linear process. In 12 weeks, you'll be able to be discharged. Like, that's a pretty typical, like, if nothing goes wrong and you had an orthopedic injury, that's a progression that a lot of, which honestly doesn't represent most of when people are intersecting with the health system, right?
Right,
But, like,
right.
it's somehow become the way. And so, I was bumping up against like all of those issues that come from like, this doesn't fit because there is unpredictability, there is waxing and waning, there's fluctuation. So I won't get too much more into that, but just to name, which I know you talk about on your podcast, is like just the realities of the limitations of our healthcare system as it exists. So happy to talk about that more, but that's how I got into kind of getting to work more with folks with chronic and progressive conditions.
No, that's so, I mean, I resonate with so many of the things that you said. First of all, I want to point out, I love that you mentioned fun and particularly embracing opportunities to find joy, not as a means to an end. So I'm just literally echoing what you said. But I think so often it's like, oh, that in our OT training, we're taught that everything comes down to like helping someone like you do something so that blank, so that you can be improve your mental health, so that, but I think like so that you can improve your range, like I'm going to dance so I can improve my range of motion and my strength and my cardiovascular fitness, and those are all meaningful things. Like if I have good cardiovascular fitness, good musculature, and exercise every day, my RA symptoms are genuinely going to be better. But also, I should dance because it is fun. And
Yeah,
it's
if
like,
it is fun for you, which it
if
doesn't have
it,
to be,
yeah,
but
I'm talking about me specifically as an
yeah,
individual. Yeah, I love dancing. Yeah, you're right. Not everyone. It's finding what brings you joy. Whether
yeah,
that's yeah, whether that's a certain kind of dance. I'm not very well versed in like salsa or tango, but I'm really well versed in like jazz and tap and Lindy hop. And if for you, it might be a sport, or it might be qigong. What is it called? Where you're like moving really
Tai
slowly.
Chi.
Tai Chi. Yeah.
Qigong is lovely too. Yeah.
Yeah, all, yoga, whatever, or if singing, being part of a spiritual community that is not only, I'm not a very spiritual person, but I know for a lot of people out there that, finding a spiritual community. I know one of my people in my Room to Thrive support group, she's really active in her church choir, and that brings her like intrinsic joy from the act of singing. Plus, it's like having her, keep in touch with like a broader purpose and sense of spirit in her life. So I really resonate with that. And the second thing I'll say is, before we go to the main topic of today of like connecting with your right now body, which I think is such a beautiful phrase, is I think it's also really, it's, as a provider, I think a lot of us like health providers, whether it's OT, PT, speech, doctors, nurses, we go into the field because we want to help people transform, like, to get better usually, right? Like if you ask me, like, when I went into OT school, like I want to do what you said, like the healthcare system is kind of set up to do. Like I want them to start at point A and get to point B. And it would be like a very linear idea in my head at that time of like, well, they start off feeling pain, and after they see me for a few weeks, they don't feel pain. And it's not an unlaudable goal if that is realistic for that patient. But as you and I will talk more about, is that's not always realistic to cure, heal, or remediate, in the words of OT. So how do we now? I've realized, and sorry, I'm kind of getting ahead of myself, but the transformation can partly be in controlling the symptoms that are amenable to being controlled, like pain or fatigue, and then the other deeper transformation is like psychologically reorienting yourself to your condition. Um, so for what that's worth.
Yeah, no, I resonate with all of that. And I do think there is this piece of redefining for ourselves, and then each individual getting to redefine what is wellness or
Mhm.
whatever word you want to use there. That doesn't, it's been co-opted, but what does wellness like
Yeah.
look like or feel like for you? Because it's not cookie cutter, and it's not mutually exclusive from living with chronic health issues, which is another narrative that I think both healthcare and the health and wellness industry perpetuate, right? That those are mutually exclusive. So
Oh
that's
my
a
gosh.
whole
And
other.
I
um,
love that. No, and actually, it's really funny. My friend, if you've heard, those of you who've listened to like every episode will remember Nitika Chopra. She is a wonderful advocate, and she runs her own support community called Chronicon. You know, like Chronicon, like the comic thing, but it's Chronicon, like chronic illness community. And she just has come out with a series of content and reflections on her podcast and her social media about kind of reflecting about like how she went all in into like the wellness industrial complex and then now is coming out of that and realizing that there's kind of toxic messaging on like both sides. So I'll link to that in the show notes as well. But yeah, I love that you said you're redefining what wellness means to you. And one of the things, before we started talking, um I always ask my interviewees, what are you most passionate about talking about? Because that's what I want to talk about. If it intersects with the mission of this podcast, which is to help people live well and figure out how to thrive with their condition. And you said on your website, you say you help people with chronic illness partner with their right now bodies and find a sustainable, kinder way of being. And I think, first of all, I love that phrase, like the right now body, because I think so often, I just was thinking about this yesterday. That's like my body is not a. I don't want to think of my body as a constant project that it's like never good enough, and I'm just like have to keep figuring out how to control everything so I like have no inflammation and I feel perfect all the time. Like or thing, on a most basic level, it's easy to see your body as broken when you have a chronic illness and get wrapped up in fixing. How in your experience working with people with chronic illness, how do you help them wrap their minds around connecting to their just right now body and getting out of that fixing mindset or finding a balance between fixing and accepting?
Yeah, I mean, I just want to name that I think it is, there's another both and there, right? It is this, I'll come back to the partnership with body, but it comes from this concept that's so central to this work, that we're kind of walking these parallel paths. As a provider, I feel like I am a companion along the journey of like both like the things that are evidence-based that will help, whether it is remediating or lessening symptoms or finding that medication regimen, which is not in our scope as OTs, but like getting people the resources in all of those directions. Yes. And what I kept hearing when people would come to me is like, yeah, but like while I'm waiting 6 months for this specialist appointment, until we know if helps or not, like this meanwhile time, like how do we make that meaningful, maybe tolerable, if meaningful feels like a far-fetched, like too hopeful word. Um, so I think that is the work, and then how that shows up in terms of like specifically the situation of like, what does it mean to live in the body that you have, especially when that is unpredictable and, if not painful, then inconvenient, uncomfortable, whatever language you would use around that. Like, it's not always like a great place to be. Like, and just how do we let that be true? So I think it comes around to like we've talked about, kind of what does acceptance mean? And that can be a big word. And I don't use that word honestly with folks. Sometimes people use that to me and then it's a shared language, but what does it mean to find a relationship with your body that can be, if not a partnership, then at least collegial. So I sometimes like do think about like, okay, think about relationships in your life, like a roommate that you kind of see like, but you don't spend a lot of time together. You're kind of like ships passing in the night, like estranged exes, all the way to like some of your best friends or your partner. Like we have so many different types of relationships externally to ourselves. Um, and I think that's a helpful model to just start by naming like, what is your relationship right now with your body without judgment? Like, if you had to pick one of those, like what would be closest, and just recognizing that and part of the why, right? And I know you've talked extensively about this, but the impact of um being poked, prodded, but by other people, by yourself, like in order to like support health in some ways, but like what are the impacts of that on your relationship to your body? What does it mean when you are having to be hyper vigilant so that you can advocate for yourself to providers or to people in your life? Like how does that change your relationship? There's so many factors outside of just being human that we all also live in, especially, I work with people of all gender identities, and a lot of people identify as women, and there are very specific cultural situations around body, like women's bodies. And so it's just, there's a lot. And I think part of it is we start by recognizing what is showing up in your relationship to your body. And that might sound very out there. We usually do that in terms of like, we are moving and then we're debriefing, or we're, like moving through something like an interoceptive awareness or like a body awareness kind of rating scale, and talking through like, wow, I hadn't even realized that on this aspect, like I feel really connected. I can tune in, but then the next step is really hard for me to know what to do. So just to like recognize that we have a relationship with our body. I know that sounds a little like, yeah, we are whole beings, but I think it can be helpful to recognize like, do I live in a way that my body is supposed to be utilitarian? In which case that can be a setup for like, if that's what I expect from my body, and that's um I'm constantly putting my body in a position where I'm like blaming it for not showing up in the ways that I need it to that day. It just can create this self-judgment and self-criticism that we know, and that is evidence-based, does not support being able to enact other self-management strategies and just to like be feeling okay day to day. So I think that's kind of, to me, where the connection, I've always been interested in embodiment and movement personally, but I was working with folks where I was like, there's something missing here. We've talked about all the energy conservation strategies, all the non-pharmaceutical pain management strategies, like they have the knowledge. And then I was starting to hear these little like rumblings when there was self-awareness around, well, why didn't you choose to do, you could tell you were at that point where it would have been helpful to do X, Y, or Z, right? Whether that was a pacing strategy, whatever it was. And so there's this element also of self-compassion that I think comes in here, right? Like how and self-compassion is something that can be very embodied. It's not just like writing. It can be like, like journaling and writing, and also like self-compassion is like giving yourself the time to show up and take good care of your body and spend time with your body. So I feel like I went on a winding journey, but I wanted to just like give the overview, but I'm happy to make it, I know it's like to make it a little more tangible too.
No, I'm totally following your train of thought, and I love the idea of naming your relationship, or categorizing your relationship with your body as you would categorize like a relationship with another human, and I think it's funny, sometimes I ask people at the beginning of the episode, what's your relationship to arthritis? And sometimes people say it's complicated. There
Yeah,
used to be
yeah,
that old
yeah.
Facebook status update that was like, in a relationship, or single, or it's complicated.
Yeah.
And I think for many of us, with chronic illness, it is very, very complicated. And there's days or moments, and like it fluctuates. There's times when it's really easy for me to be like grateful for my body and what it's able to do, and feel compassionate, and that I can imagine my little immune cells, like they're trying their best, and they just happen to be making a little mistake and attacking the lining of my joints. And other times I'm like angry at my body and want to like trade it in. Like there was a point, anyway, this is longer, but I had like a real rock bottom where a whole bunch of acute health issues had layered on top of my chronic illnesses. So it's definitely not just quote unquote just the RA. But in like 2017, where I started having panic attacks and I started feeling claustrophobic in my body. So it's technically like claustrophobia, like fear of being trapped. And I was trapped in my body. And I kept having this visual of like a head transplant where you just like get my head onto someone else's body. And like I wanted to get out. And this is again much deeper about like my GI issues were really bad. I was having a really bad gastroparesis where I couldn't digest anything. So I was malnourished and I'd had a car accident and a pilonidal cystectomy, and then I had a norovirus where I kept throwing up, and then that shut down my GI. It was just a whole bunch of stuff. So
Yeah.
I'm laughing but like out of like it was just overwhelming. And I think like being I was going to therapy at that time, but I think it no I think that I wish I had maybe even started therapy earlier,
Mhm.
and I think the earlier you can develop a compassionate relationship with your body, the better. Because I could definitely say that it was not helpful that I was lacking compassion. I was just angry and I just wanted to cut it off. I guess what would you call that? Like a abusive or like avoidant? Like I
You
almost like
wanted to put a restraining order
yes,
on.
yeah.
Yeah.
And but the thing that the other thought I wanted to say that's a little more maybe relevant to people listening. I mean, hopefully what I just said was relevant to some people so they don't feel so alone. But the thing that comes up a lot in the population of the Room to Thrive support group, and just literally came up yesterday, is this idea that when you've been living with pain for a while, you can actually like become disconnected from your body where you kind of what was the word? Detach so
Mhm.
that you don't have to process and feel the pain. And then when you start the somatic work, like when your therapist or OT or whoever asks you, like, where do you feel that in your body? And they try to help you become more connected. It can be really scary because you're like, my coping mechanism was avoidance or was detaching from my body. And now you're asking me to attach. Has that or to feel what I'm feeling in my body. How do you help people work through that? Or do you ever see that?
Yeah, it's a really you brought up so many, I'm bookmarking like
Yeah, I
good
know.
points. And
Look at a
so I
whiteboard as we're talking.
yeah, yeah. I so a couple things. Um, I'll clarify that because I am not a licensed psychologist, I do not do somatic is like so many people are using that word. So I just want to
Oh
clarify when I
yeah.
talk
I
about
actually
like
don't
somatic.
I no, please correct 'cause I thought somatic therapy is just
No, no,
like
no. That's I think there's
anything.
not like a registered trademark, but just if people have experiences around, there's a practice or approach or method called somatic experiencing that is
Mhm.
specifically used by psychologists and therapists. I'm not trained in that, and so if anyone listening is like, oh, SE or somatic experiencing, that's its own. We're just going to bracket that here because I can't
Okay.
speak to that. But when I think about like body somatic, lowercase s, yeah, there are so many pieces that make it really comfortable. Uncomfortable. So I want to zoom back and just say at the beginning of this, for so many things in the life of chronic illness, like you're allowed to be wherever you are. And so, like when we talk about mindfulness, you don't need to be mindful all the time. There are times when it is good to distract yourself. Same thing with body. You don't need to be connecting to your sensations all the time. That can be flooding, right? For many different reasons. So there's not a should around this, which is why the work I do is only when people like want to, which doesn't mean there aren't challenges, but like say like, here are some of my goals around like the relationship I'd like with my body and movement and connecting in that way. And so we start from where you are, and I talk about this around trauma because the movement approaches that I'm trained in are trauma informed. And I'll give one example if people want to look up Lynn Stoller's work. She's an OT and a yoga therapist, and one of the first trainings I did was her sensory enhanced yoga that is specifically around trauma healing, is evidence-based, growing, primarily started with veterans with PTSD, but it continues to kind of undergird research around like now what we know about trauma is that there are a lot more ways than when I first was like reading the DSM to define that. And there's some emerging research around that in living with a long-term chronic illness doesn't mean that this is everyone's experience, but can be traumatic or considered a trauma. So we think about so when I talk about this bit about trauma, I say that in that context. Not everyone will identify with that specific language. But that trauma and like living with chronic stress, chronic pain, I'm going to talk about all that together, even though there's, different experiences that impacts physical and psychological experiences. And we see those changes also at the brain level in terms of where we see activation and deactivation or inhibition, which is like where Lynn Stoller's work might be interesting to some folks, because I'm not going to get on my neuroscience nerdy trip today. And it also means that because of that connecting with your body, it makes total sense. And you are not alone if that is confusing, chaotic, and it can be unsafe to do alone. And by unsafe, I mean it can, especially in the context of traumatic experiences, it can, which is why people will often do this work with somebody alongside who is trained. So just wanted to name those two things. And both and we know the research shows that mind-body practices, by which I mean bottom up. And by bottom up, I mean we are moving, we are doing the things rather than with this where I can't speak to SE, but there are approaches where we're sitting with or maybe taking a more cognitive or top-down approach to like envisioning the body. So the work I do is like we're moving, we're getting into a posture, but we're like experiencing something through the body, which is especially if there is ongoing pain, if there is a history of trauma for any reason, like that is where we're able to bypass some of those re-experiencing pieces, and where we're able to slowly find ways to have positive to neutral, sometimes neutral experiences with movement, right? And so just wanted to name that too, because I do think there are different ways of approaching somatics. And so the perspective I come from, the training that I've done, and my understanding of what is helpful is in the doing, the checking in, starting where you are, which might be nothing that looks like yoga. I don't only use yoga. So I say I do mindful movement because I use what supports the client. And so that might look really subtle. That might not even look like a thing. That might be, we are connecting to breath, right? And where does that land with you? That might be the place we're starting. So it really looks different for each person, but just wanted to speak to that piece since you brought up that for so many it is it's like why would I choose to do that? Like why? Because this is the only way that I'm getting through day to day is really by dissociating, or whatever language you want to use around that, compartmentalizing. And if that's where you're at, that's okay, unless it's not working for you long term, unless it is cutting you off from relationships, from meaningful roles and activities, right? If it's a long-term strategy, it often, and it's the only one, it often isn't sustainable. So that's where we start thinking about like, how is that impacting, which is what OTs often come back to, is like, how's that impacting the rest of your life? If it is working for you, that's not anything that I need to poke a hole in because there's some like theory out there or there's an evidence base. Like your life is also your evidence base. So just wanted to name that too.
Yeah, that's super helpful. And I hadn't actually not heard about the sensory enhanced yoga as well. So I'm going to check that out and definitely put a link to Lynn Stoller in the show notes as well. And I love the distinction between like a top down versus a bottom up approach. And I don't know if the people listening have heard of that before, but it's like a concept that applies to a lot of different kind of practices, whether, if you're talking about cognitive behavior therapy or, yoga and stuff like that. And the other thing I wanted to, that's kind of adjacent to all this that I wanted to ask you about as well is, you mentioned before we start talking that and that you really like to help people learn to become their own loving companion along the journey. And I wrote these quotes down so I didn't mess them up. I think that's just, again, that's such a poetic, beautiful phrase, and like almost like deceptively simple though. Like, or it deceptive. It sounds like, duh, I would want to be my loving companion. But again, that is hard on a daily basis when it feels sometimes like your body is revolting against you, or that you have this unpredictable, almost like a little yeah, when your body's unpredictable, it's hard to connect to it sometimes. So how do you help people be like a loving companion on their journey? Yeah.
Oh, that's like the question, isn't it? I wish
Yeah.
I
Yeah.
could. Just a heads up that I won't be giving a steps 1 through 4 on that. I
Yeah.
will, but I'll name a few of the stops along the way, I guess. The reason I see that as the overarching goal, and of course, with each individual, we have more specific tailored goals, but is because it is a journey. So I think that's something that's really important to name. And depending on listeners, like where you are, like you might not want to hear that. You might want to be like, I don't want to be on a journey. I would like this to be like over and done. And at some point, if you are living with long term, which doesn't mean forever for everyone, but long term and or chronic health issues, that is a journey. And so the way I think about this is if you, and I'll come out of metaphor in a second, but I think it can be helpful to have some visual. So when I say journey, I don't think of like, oh, I signed up for like, I don't know, this lovely like walk through the woods where somebody's packing my lunch. Like if you've been recently diagnosed, or if you remember when you were diagnosed, like that's generally not people's experience. Like it's kind of like being dropped in the middle of a wilderness. If anyone's like read Hunger Games, watch Hunger Games, like just drop there. Don't really have any, maybe not the whole like children killing each other, but like no one gave you a map for what to do. Like you didn't choose this. This is not a like luxury cruise that you signed up for. So I don't want to like say like, oh, this is going to be so fun, even though there can be fun along the way. So I kind of think of these 3 phases that again, like aren't linear, that I think can kind of we can move back and forth through. But that first piece is orienting. And Cheryl, I think you do such a great job at like I think you reshared recently one of your top favorite podcast episodes of like for folks who are recently diagnosed. And so I think of that as like an orientation period. And that can happen when there's a change, a new symptom or a medication change. That can happen over and over again, but especially that first time after diagnosis. And the things we're thinking about together there are right now, like this is a gathering resources and support time. And that can look like who's the next person, who's the next provider I need to get onto my team. You talk a lot about how important that is to be identifying and building a team along the way. But resources can look like so many things. What does my social support look like? What are those resources? Imagining that when you're dropped off with like nothing but like what's on your back, like, okay, I'm going to have to start to pull together something for this journey that I didn't sign up for. I think this is also a time when we're thinking about clarifying what are the priorities right now, especially either after an initial when there's like both shock and also possibly a diagnosis because there was a change in function. Like priorities often need to shift. Sometimes that's not even a choice. It's not like sitting down and being like, let me clarify my priorities. And often there is this point where we have to be like, have a conversation about like, you are in a different season. You can feel all the things you want to feel about that. And how do we like prioritize so that you can meet your like most important needs right now and take those next steps. And then we come to this place of like, what are the intentions that we're setting? And so for like therapeutic work, that's more specific. But I think this roadmap is something that when you're thinking about being your own loving companion, or I think of like, I'm trying to teach people to OT themselves, because those are self-management skills. When we say self-management, I don't know if you've defined that. That can sound really clinical, but it's like all the things that no one teaches you, except people like Cheryl and I, who lead groups around this and try and do the work of teaching, but around what does it mean to live life with a chronic health issue, right? Everything from med management to social, how do I have conversations with my friends and loved ones, all of that. And so that orienting, again, that can happen more, of course, more than once. Eventually we kind of like, if we're back in the wilderness, we're like, okay, like I kind of think I don't know cardinal directions, but like I kind of know where I am ish enough to like, I need to move in some direction because I can't live here forever. So like, what is the next right step? Not like, I might not even know, I might not even see that destination. Remember, this is not like a pretty paved trail we're on. But that next piece is where I think a lot of work, especially in therapy context, happens, which is the exploring. We've set intentions. Sometimes people say goals. I like saying intentions I'm not talking about like the measurable SMART goals, but like for the season, what are the priorities? And then you're taking action, you're assessing, and you're adapting. And that can be true for whatever that intention or goal is, right? Like we have an idea of what that action looks like, but the reality is a lot of this is trial and error. So like I tried this change in my routine, or that can be for anything. How is this working? Assessing, going back, revising. So this is like a lot of life is in that messy middle, right? And then this is where you're also building those skills and self-trust to like trust yourself that even in the uncertainty, which is always there pretty much, that I can make a choice and decide what next is the next right thing. And I can, even if that ended up not leading where I thought it would, that I know that I can come back and connect back to my priorities, where I am, and I will ask for help when I need it. And also, I'm the one, right? Like you're the only one living your life, no matter how much support you have around you, right? And this is where like partnership with body, not just in the like that interoceptive, like self-compassionate way, but also like learning to trust what you're learning and to self-advocate, and all of those skills are happening in that. So it's, and then, and back and forth, we get to this place where I kind of think of it as the generative place, which doesn't mean that the things are solved, right? We're not coming from a fixing model, but I think of this as like where you're creating your path. You really are this is all trailblazing. That's why I think of like a path, like we have some road markers, I guess, from people who've gone before, which is why it's so important to find other people. Everyone's experience is different, and there are things we can learn from others around us. But this is where there's a little more flow that season of like, okay, yep, there's still going to be things that come up that are unexpected, and I have rhythms and routines that I know are pretty consistently supportive, or I know how to revise those to support myself if something changes. I'm able to envision, I'm coming out of just like survival mode and like, okay, I can do this, and I can go back and finish that degree that I like abruptly stopped, or I feel like we can think about, another kid, or whatever those things are that have been put on the back burner, where there feels like there's more space for that. And that whole process, going through that whole process, to me is how you can become your own companion, is just through like doing it and showing up, usually with somebody alongside you at first, modeling that. And that's why I think the power also of community is so powerful. I just said the power of community is powerful. It is. But like, we learn that by also offering it to others around us, right? Like we walk alongside, and then we recognize when we can't go places with people, we can't go to that appointment. We can help prepare from a provider perspective. I can talk through that with you. We can debrief, and you show up by yourself, even if it's with a partner. Most people will be like, it's still me. Like, this is still like my journey. So the answer to how, those are some of the way markers. And I think the bigger answer to like being your own loving companion is like trying and failing, and having the days where you like still are like, the self-critic is louder than the inner advocate, and recognizing when that's happening and continuing to, like, Naira Wahid is a lovely poet, and she has a few lines. I want to get it right. Um, she says, "Be easy, take your time. You are coming home to yourself." And she didn't write that in the context, I don't think, of experience with chronic illness, but I think about that a lot. That it isn't a linear journey. No one can, if somebody tells you, here's the 10-step plan or protocol, I might be a little cautious about that. But those are some of the things that I've seen time and time again as like the directions that we head together.
Yeah, that's so comprehensive, and I resonate with that so much. And I think, it's just your idea of like you not wanting to maybe be too rigid with a step-by-step protocol makes sense. But also it kind of reminds me of like the word how the word acceptance is kind of complicated. I think the idea of having like a rigid framework can be complicated, but really people do feel so destabilized after a chronic illness diagnosis that often having the idea of steps to follow is itself therapeutic, right?
Totally.
If you say there's these
Yeah.
kind of three phases, or think about the phases of grief, how they're
Mhm.
not meant to be linear, even though a lot of people take them as linear. They're
Yeah.
not designed to be linear stages of grief. They're designed to be things you go in and out of. But even just being able to name them is so powerful. And I love that, when you communicated to me that help people become their own loving companion. What I thought that might mean at first was like, I don't know what you would call these, like maybe self-esteem kind of things from like that I grew up doing in the 80s where you're like look in the mirror, like I love myself, like like I guess that's more the top down, like where you're and that's not bad, right? Everyone has different tools in our toolbox that help. And certainly like certain mantras or like um things that reminding yourself that you are worthy and dismantling your own internalized ableism, those are so helpful. But also I love that it's like an action oriented framework where like you develop your trust in yourself through the action that you've already taken. Is that
Yeah.
right to say?
Yeah.
Yeah.
But like in the, I don't know, like in the doing, in the showing up. And the key part is like there is this piece of like recognizing and honoring and affirming, right? Like
Mhm.
not just in terms of like mantras and affirmations, but like I'm doing this. Like, there isn't a perfect way to do this. There's no one right way to do this. No one knows how the hell to do this. Like,
Yeah, yeah, yeah.
and I am, and that's messy. And yeah, so yeah, there is action in there because you're living your life, and there inherently is action that needs to happen, especially when whether you're newly diagnosed or not. Like that's the reality is like there's usually always something to be doing or following up on or
Mhm, mhm.
shifting. So yeah.
Yeah. This is so helpful. I mean, it's gone by really fast, but I do need to move on to the rapid fire questions, but I can already tell we might need to do a part two. Yeah, and well, I mean, you've shared so much wisdom, but is there anything specific that you like to share with people in that orienting phase with a brand new, like sometimes it strikes me if someone writes a review of the podcast and they're like, I just got diagnosed like 2 hours ago and I've looked up arthritis podcast and found yours. I'm like, like, so the brand new, what would you say to somebody who, like, just got diagnosed?
Yeah,
Hard,
I
right?
don't have like this might not sound like quippy, but I think just that reminder, like this is a journey and you don't have to go it alone. I think there can be a lot of
Mhm.
isolation or expectation that I have to figure this out alone. So I think both of those, like it's a journey, I think sets that up as like it will be a process and you don't have to do that on your own.
Yeah, that's beautiful. You can't repeat that enough, and, um, I love it. And do you have a favorite, like, inspirational saying or quote for difficult days? I mean, I loved one you just shared, like,
Mm.
but "Be easy, take your time, you're coming home to yourself." But is there another one or no?
That's probably the one from
Yeah.
somebody else that I yeah use the most. Something that I say, which is weird, like no one needs to like go around quoting me on this, but a phrase that I found myself saying to clients quite often is, "You're allowed to be human."
Mm.
And that covers all manner of things. You can take it how it lands with you. But especially because there can be a lot of weighty expectation on how to show up. Like, you're allowed to be right where you are, with whatever feelings you have, with however things are going, and you're allowed to be human. Yeah.
That I love that. Again, something I can't repeat enough myself because I often am like, everyone else is allowed to have mistakes, but not me.
Right.
Like,
Yeah. Of
yeah,
course.
there's a funny I want to give credit to this person, but I don't remember who it is, but I'll look it up on my own Instagram. There's a sound where someone's like, you don't have to be perfect, or you don't even have to be really good or exceptionally good, but I do.
Yeah. Right. How we have such different standards or something, like we exempt ourselves from that kind of grace that we offer to others.
It's so
Yeah.
well, that's why I think groups and or even just any social support is so key because we tend to find it much easier to give that compassion to others.
Yeah. Totally.
Well, and this is maybe not super relevant, but from your OT background, do you have a favorite arthritis gadget or tool in the toolbox?
I am so not in the gadget world, and
Yeah,
I was
yeah,
thinking about this, and the one that honestly that I personally like stole from clinic was a
yeah.
piece of Dycem.
Oh
Um,
yes.
so I'm sure there are like fancier versions. Basically, for those who are listening, you can Google Dycem, but it's a non-adhesive but sticky. Is that the best way to describe it? Like
I yes,
it
100.
a non-adhesive but sticky thing that like for opening jars or for just like increasing grip on anything, or putting between, well, sometimes put it between like a slippery surface, like underneath like a table if you don't have a placemat that's sticky. But honestly, like you can cut a sticky placemat instead of like Dyson. I think is something that clinics tend to use more than people. But
No, but I've
I
had
feel like I give those out to friends, family. I'm like, here, have a, because they're way better than the jar opener things that are out, the other ones that are not very grippy. So
no,
that's
it's one of the things where it's the old standard classic, but I've had so many patients tell me that it's like surprisingly helpful. And I like those. On the one hand, I do have certain gadgets that are very, very specific. Like there's a special like eye drop opening aid that helps with that is for these specific, if you're watching the video, I have
yeah,
the tiny single-use vials of eye drops, which are used a lot in Sjogren's. And for me, I have really dry eyes. So for rheumatoid arthritis, and like you need a really specific tool for that. But things like Dycem, they're so multi-use. You can use it to open your nail polish, you can use it to get better grip on your tweezers. You can use it to on your hairbrush, on your fork, on your plate. Like it can be used in so many ways. So in your car, to open this, I don't know, to get a better grip with a steering wheel or something like that. So love it. Classic. Do you have
classic.
a favorite? This is where this is where I'm going to start tugging. This is going to be the severance era of this podcast. No, just kidding. But those of you who follow my social media know I'm obsessed with the TV show Severance right now. But do you have a favorite book or movie or show you've been watching recently? Or
Oh, Great British Baking Show. Thankfully, I had stored up a couple seasons because I can't watch anything stressful. The world is on
yeah.
fire. And so
Mhm,
I just need
mhm.
people who are making delicious things and being kind to each other. So that is definitely what I've been watching a lot recently. And I also, I didn't read this super recently, but I was rereading parts of it that I wanted to shout out. Rebecca Tossig is an author. I don't know if you're familiar with her, but she is a disability advocate and an author and just like a lovely person. I think she has a Substack. I think it's called This Too, but I can share that. But she has a
Oh.
book sitting right here on my um
Oh, Sitting Pretty. Yeah, I
sitting
do follow
pretty.
her. Okay, I just
Yes.
no, I
And
didn't know her actual name.
yeah, The View from My Ordinary Resilient Disabled Body. And this is just something if anyone's watching, I have a million tabs in this book. And it's just something I often just go back to pull not inspiration, honestly, like the nuggets. And it's also, she's a great writer and was hilarious. So sometimes I'll reread when she talks about her dating experiences. So
Oh my gosh.
definitely
Thank you
recommend
so much for that, Rick. I am putting this in the show notes, as with all our other Ricks. And again, you've all of your reflections have answered this in one way or another, but for the record, so what does living a good life and thriving with rheumatic disease mean to you as a provider?
Yeah. Um, I think the most important thing is that what does it mean to the person who's sitting in front of me? I think I've done a lot of work at trying to um, withhold my own what I bring into the situation and really center like what does that mean to you? To me, when you feel aligned with your values, where your time and your energy can really be aligned with what you care about, that's a great indication to me that you can be present in your most meaningful relationships. Um, and if not thriving, because I know that can feel like this lofty goal, then like feel like the life that you have right now, there is good and all the rest of it, right? There's all the rest of it too. So yeah, I think that's what I'd say.
I love that. I love the word aligned, like feeling aligned. And even just like when your time and energy are aligned with what you care about, like I just, that's to me like definitely something I like measuring, being able to visualize it that way, because sometimes our my yeah, sometimes it's not. So
Yeah,
it's good to ask yourself, is your time and energy aligned with what you care about? I love that. And again, I just appreciate all the time that you've shared, and the wisdom, the nuggets of reflections. And I'm going to put your links in the show notes, but can you just let everyone know verbally as well, where can they find you online and on social media?
yeah. So my website is my name, Lindsay Voorhees. You can reference all the vowels when Cheryl puts us
And
in.
it's Lindsay with an A. Lindsay with
Yes,
an A.
with an A, double O double E.com.
Mhm.
And I am not the most active on social media in these days for my own mental health reasons. But I am at Lindsay Voorhees Wellness on Instagram. So
No, and you and I have had the pleasure of, being able to talk with you, and, and become, closer friends with you. And I appreciate your example of like setting an example for me of having boundaries around social media is something I'm still really trying to negotiate, because it's like everything we talked about. It's not an either or, it's a both and. It's so life giving, and so the connections to the chronic illness community on social media are so deep and meaningful to me. But at the same time, there are days when, to put in the words you were sharing before, the time and energy I'm spending on there are not aligned with my overall mission. I'm getting caught up in, like anyone else, we're all, like you said, we're all human. So I'm very
yeah,
self-compassionate to myself, but also like, I'm still just negotiating. I'm sure it's going to be a work in progress for a long time. And I just learned from examples from others of how they've been able to say, okay, like this is what I'm willing, this is the amount I'm willing to engage on social media, and no more, you know.
yeah. And that changes, there are different seasons too. So I think
Yeah.
that's helpful for thinking about it.
Yeah, that's such a good point. There's people whose accounts I connect with and learn so much from who have stopped posting and haven't posted in like a couple years, but you can, there was a season that they were really active, and that's, me, having a meaningful impact on the world years into the future. So thank you so much. And Lindsay has a program called Root to Rise, which again is so beautiful. I think you need to write a book, by the way. Not need to, but if you ever want to write a book, I will support you and cheerlead you through that, because you're very eloquent.
Oh, that's very kind.
And not to put more pressure on you. Sorry, that's I'm really good at like giving other people like like ambitious ideas for what they should be doing with their lives.
Run with this.
Yeah, yeah, yeah. Oh, and there's, if you really, you all should check out the YouTube video, because and you can find the YouTube video on my website, arthritis.theenthusiasticlife.com. But you can see Teddy, puppy, puppy. Oh, he's so tired. He's
resting.
sleeping. He's a good example to me of rest. Oh, wow, he is really tired. All right. Well, thank you again. We'll talk to you later. Bye-bye for now. Thank you so much for listening to another episode of the Arthritis Life podcast. This episode is brought to you by Room to Thrive, an educational program I created from scratch to help you go from overwhelmed to confident, supported, and connected in a matter of weeks. You can go through the pre-recorded course on your own, or you can take the course along with a support group. Learn more at the link in my show notes, or you can always go to www.myarthritislife.net. And if you like this podcast, I would be so honored if you took the time to rate and review it. I also encourage you to share it with anyone you know who might benefit from it. I also wanted to remind you that you can find full transcripts, videos, and detailed show notes with hyperlinks for each episode on my website, www.myarthritislife.net. If you have any ideas for future episodes, or if you want to share your story or wisdom on the podcast, just shoot me an email at info@myarthritislife.net. I can't wait to hear from you.